Hello, my name is Mary Laxton, and I'm a physician assistant with the COVID Containment Division of the Philadelphia Department of Public Health. Today I'm going to review information about COVID vaccines. I hope this presentation answers questions and fills in some gaps in your knowledge about COVID-19 in Philadelphia. In this presentation, I will cover a clinical review of COVID illness, some guidance and data. I'll provide information about COVID vaccines and make an effort to debunk myths and tell you about the facts. Want to talk about where and how to get the vaccine locally, and to discuss vaccine protection against COVID variants and how long the vaccine is likely to protect you against a COVID illness. In addition, I've included links to resources at the end of the program so you can learn more as your own time permits. So what is COVID-19? COVID-19 is an illness caused by a respiratory virus that spreads very quickly from person to person. The virus that causes COVID-19 most commonly spreads from respiratory droplets that escape when you sneeze, talk, sing, or cough. The virus can sometimes be spread from person to person by small viral particles that linger in the air for minutes to hours, especially in enclosed spaces with poor air movement or poor ventilation. COVID causes an illness that can be completely symptom-free to ones with mild, moderate, or serious symptoms, and COVID can be fatal. COVID-19 symptoms appear 2 to 14 days after exposure to the virus that causes COVID-19, and these symptoms include cough, shortness of breath, difficulty breathing, fever or chills, muscle or body aches, vomiting or diarrhea, and new loss of taste or smell. In addition to sharing with you the signs and symptoms of COVID, we want to prevent the spread of COVID in our community and country. Surely you know by now the guidance that addresses COVID prevention. That includes wearing a mask, practicing social distancing, washing hands, avoiding crowds, seeking testing, and staying at home if you feel sick. But by far the best and quickest way to slow the spread of COVID-19 is to get a vaccine as soon as you are able and eligible. Now I'd like to look into the issues about vaccinations and getting vaccinated in Philadelphia. COVID cases or infections and deaths from COVID-19 peaked in January 2020 and have been declining ever since then. These declines are due in large part to the very successful vaccine rollout and distribution of COVID shots in arms. Now I'd like to focus on the vaccines themselves. 3 vaccines are approved for use in the United States under an emergency use authorization granted by the Food and Drug Administration. These vaccines are manufactured by Pfizer, Moderna, and Johnson & Johnson. Moderna and Pfizer use the same technology, that is, a messenger RNA technology, and both are similar, requiring 2 doses each. The Johnson & Johnson vaccine is a 1-dose viral vector vaccine. The Pfizer vaccine, as I said, is an mRNA vaccine of 2 doses, spaced 21 days apart. It's approved for individuals ages 12 and up. The Moderna vaccine is also an mRNA vaccine, 2 doses, but spaced 28 days apart. It's approved for ages 18 and up, but Moderna is seeking emergency use authorization to distribute it to children at age 12 through 17. The Johnson & Johnson vaccine is a viral vector vaccine. It's a 1-dose vaccine, and it's approved for individuals ages 18 and up. But some individuals are still wary of or hesitant about getting vaccinated. Let's look at some of the reasons this may be so by addressing some of the myths. The first myth is that the COVID vaccine is not safe because it was rapidly developed and tested. Well, the pandemic warranted an emergency response, so developing a vaccine was a very high priority. But that does not mean that companies bypassed safety protocols or performed inadequate testing. The vaccines were developed rapidly because the genetic code was mapped only months after the novel virus emerged. The federal government put billions of dollars into research and manufacturing started while the clinical trials were still underway, when normally manufacturing doesn't start until the vaccine has been approved. And finally, the U.S. government guaranteed payment for vaccines, even if they were unsafe or did not work. But all of the required regulatory steps, including those guiding safety and efficacy, were taken to produce these vaccines. This all happened in a condensed period because we were in the midst of a pandemic. The second myth, I won't need to wear a mask after I get the vaccine, is actually becoming fact. But until a sufficient percent of the U.S. population is vaccinated, we must continue with precautions such as mask wearing and physical distancing. Another myth that causes people to hesitate to get the vaccine is that there are severe side effects from COVID-19 vaccines. And while it's true that many people have side effects from the vaccine, the side effects are generally short-term, mild to moderate reactions. Some of these side effects include pain at the injection site, headache, chills, fatigue, or fever, and these symptoms last for just a day or two. The side effects indicate that your immune system is responding to the vaccine, and they are common when receiving many vaccines. People with severe allergies to foods, certain medications, latex, bee stings, or venom can safely receive these vaccines. There is a myth that one's ability to have a baby will be affected by getting the vaccine. This is a myth that has no basis in fact. However, it is widely shared and unfortunately believed. There is currently no evidence that antibodies from COVID-19 vaccine cause any problems with pregnancy or in the development of the placenta. Finally, there's a myth that the COVID vaccine was developed as a way to control the general population through microchip tracking. There is no vaccine microchip, and the vaccine does not track people or gather personal information on anybody into a database. This myth, too, is not based in fact. I would say that if you're concerned about being tracked by the U.S. government, then you should get rid of your cell phone, because that is a fact. You can be tracked through your cell phone. But let's focus on the facts of COVID-19 vaccines. Fact number one, COVID vaccines will not give you COVID-19. None of the currently authorized COVID-19 vaccines contain the live virus that causes COVID-19. This means that the COVID-19 vaccine cannot make you sick with COVID. Fact, COVID-19 vaccines will not cause you to test positive on antigen or PCR tests. They cannot cause you to test positive on viral tests because they can't cause you to have the illness, which is what the viral tests do. They detect for current infection. COVID-19 is associated with severe health risks, and getting vaccinated will prevent serious illnesses, hospitalizations, and death. So it is a fact that getting vaccinated can prevent getting sick with COVID-19. Fact, people who have gotten sick with COVID-19 will still benefit from getting the vaccine. Even people who have had the infection will benefit because at this time we don't know how long someone is protected by the natural immunity after recovering from COVID-19. But evidence suggests that the vaccine affords longer protection against COVID than does natural immunity. And the final fact is that the vaccine does not treat or cure COVID. No vaccine treats or cures the disease. It's intended to prevent. It's simply that, a preventive measure. So which vaccine is the best one for me? Well, the best vaccine is the first one that's available to you. There's no preference for any of the vaccines because they are all very, very effective. Despite hearing numbers such as 94%, 95%, and 72% effective, one cannot say that one is better than another. The vaccines were not directly compared, and the trials on these vaccines were done at different times in different countries with different rates of COVID-19 infections and with different COVID-19 variants. Will I be protected from COVID-19 variants? So far, studies suggest that currently authorized vaccines cover the known COVID variants in the U.S. This is being closely investigated and more studies are underway. The data is looking very good on the research about protection against variants. And in fact, the best way to combat variants from forming is to vaccinate our community, because a virus has to have an ability to infect an individual in order to mutate and become a variant. So vaccinations prevent variant formations. A couple final words about effectiveness. As mentioned, the Pfizer vaccine and Moderna vaccine are 94 to 95% efficacious against the illness, and the J&J vaccine is about 72% effective against hospitalization and death. But suffice to say that all vaccines are very effective in preventing disease in fully vaccinated individuals. And fully vaccinated means it's been 2 weeks after your second dose of a Pfizer or Moderna vaccine, or 2 weeks after one dose of a Johnson & Johnson vaccine, and that they are all highly effective in the aggregate, greater than 89% in preventing illness severe enough to require hospitalization and death. Usually, side effects for the vaccine happen a day or two after vaccination and last 1 to 2 days. Side effects are more common after the second dose in a 2-dose series, and it's okay to take over-the-counter pain relievers to treat the symptoms if they occur. The most common symptoms from either the RNA vaccine, mRNA vaccine, or viral vector vaccine include injection site pain, meaning sore arm, headache, muscle aches and pains, fatigue, and fever. Once again, the side effects generally appear 2 days to 3 days after the vaccination and last 1 to 2 days at most, and are treated effectively with over-the-counter products. And all of the side effects that occur indicate that your body is building protection against COVID-19. And the bottom line is, people who are concerned about side effects should ask themselves, are the side effects an issue in a disease that kills 2 to 6% of people in the U.S. who become infected with COVID? As you know, some vaccines, such as those for measles, mumps, and rubella, can confer a lifetime immunity. Others, such as the flu vaccine, require a new shot every year. So what can we expect from the COVID vaccine? Well, it appears that protection lasts for at least 6 months, but experts believe it will be much longer than that. And immunity is simply not going to just drop off after 6 months. The fact that COVID-19 vaccine effectiveness has remained almost unchanged over the span of the study period and the use of the vaccine period is an indication that the protection will be quite enduring. And if we do need a booster shot for COVID, we know that it'll be easy to produce the vaccine in the new mRNA technology, which some compare to a plug-and-play type technology. And experts believe that a situation in which we need to have a booster shot is not because the first dose of the vaccine faded, but because there's a new variant that might emerge for which the vaccine is not effective. I'd like to talk a moment about the cost for COVID vaccines. Well, COVID vaccines are free and no insurance is required. Because the federal government purchased all the vaccines, there's no charge for the vaccine itself, and no provider or vaccine dispenser should ask to be paid for giving the vaccine, and an individual cannot be billed for the copayment for a vaccine. That's against the regulations. And there are ways to report individuals or organizations that are charging for the vaccine, and there are ways to get money back if you were charged and paid for a vaccine. Check with your own healthcare provider about that, or call the Philadelphia Department of Public Health. So what goes into making a decision to get vaccinated? First of all, one should know that the benefits of vaccination far outweigh potential risks from the vaccine. Natural immunity may not protect you as fully or for as long as a protection that's afforded by the vaccine. One wants to consider their own risk of exposure to COVID-19 where they work and live, and their own medical history to determine whether or not they are at high risk of developing severe COVID. And finally, we ask everybody to become informed and make the best decision, not just for yourself, but for the people around you. Who can get the vaccine in Philadelphia? Well, you can get the vaccine. As of April 16th, all Philadelphians who meet the age requirements are eligible to get the vaccine. Vaccines are now widely available in the city sites, city-run sites, and pharmacies and at providers' offices. So there is an abundant supply of vaccines, and you can get it now. It is clear that there are many health benefits to receiving a vaccination and becoming fully vaccinated. In addition, there are many social restrictions that are lifted for people who are fully vaccinated. The city is relaxing opening guidance for restaurants, theaters, and more as vaccinations rise and cases drop. And masking requirements for fully vaccinated individuals are relaxing as well. So there are many benefits to receiving a vaccine, not just the medical ones, but the social ones. How do you get vaccinated? There are a number of ways to find out. First of all, you can call 311, which is the Philadelphia Department of Public Health call center. You can go on the PDPH website, visit vaccines.gov. Social media, emails, and word of mouth can suggest how to get a vaccine. You can call your physician or pharmacist. In addition, Philadelphia has a homebound vaccination program for individuals who cannot leave their home but want to be vaccinated, and we will bring the vaccine to them. Here are some additional resources should you want to learn more about vaccines, from the frequently asked questions, overcoming vaccine hesitancy, how to talk to family and friends about the vaccine, and about some of the African American vaccine hesitancy. And for those of you who are convincing your clients and patients about the vaccination, about the benefits of vaccination, I hope this slide program has helped you and that you will tap into these resources and reach out to the Philadelphia Department of Public Health if you have any additional questions. Thank you for your kind attention, and add to Philadelphia's vaccination numbers by getting yours.
Hi, my name is Susumola Shrinka. I'm the Chief Medical Officer for the Department of Behavioral Health and Intellectual Disability Services. I'll be speaking on vaccine hesitancy or vaccine anxiety and sharing a few tips on dealing with this increasingly common phenomenon. And so some of the common causes of vaccine anxiety in particularly today is the constant barrage of information, particularly when we consider the multitude of or multiplicity of news sources that we have available to us nowadays, as well as very often the sharing of conflicting information and sometimes, frankly, misinformation. And so it's simply difficult for many people to keep up and keep things straight. And also for those, particularly for those who are working and are caregivers in one form or other, whether they're caring for young children and homeschooling young children and working remotely, or providing care for others in some other capacity, it's often challenging to keep up with all the decisions that need to be made. And this is a well described phenomenon of decision fatigue. And although this is less of a concern now than earlier on in the vaccine distribution process, there were significant concerns about how to get the vaccine, particularly for individuals who might have been at higher risk of contracting the COVID virus in the process of trying to get vaccinated. So a bit less now that there's there's an abundance of ways to get it, but certainly a valid concern earlier. And particularly for communities and persons of color, there's a well-documented history of racism in medicine, as exemplified by the COVID pandemic itself. And I will say the current real experiences of individuals trying to access care and experiencing interpersonal, structural, institutional racism, which understandably leads to hesitation in seeking care. And then the entire uncertainty about the pandemic itself, which again, hopefully we're on the backside of that now. Um, I think it's important to just at this point say that these concerns are valid, they're rational, they're not irrational at all, and it's given the experience that the entire world just went through. They're completely understandable. So let's start with that, and then move on to ways to combat this vaccine anxiety. And like with many other anxiety provoking issues, it's important to focus and try to pin down what exactly is of concern. So in this space of regarding the COVID vaccine, common concerns include worries about whether the science, whether the vaccine was development process was rushed. Again, communities of color, persons of color have the well documented history of mistreatment of persons of color in the U.S. healthcare system, and but there are answers to many of these concerns. It's important to really focus and narrow down on what those concerns are. And then it's always important, once you've done that, to do your due diligence. And I would add to that, doing due diligence using validated sources. So the CDC, the Centers for Disease Control, has put out a lot of material and really updated material around the vaccines, around how to get the vaccines, around the development process, and so on. And the Philadelphia Department of Public Health has similar material vetted by experts and readily available online. So those would be two good sources, and maybe less. I'd recommend prioritizing those as sources of information over some of the material through other media. It's also important to discuss your concerns particularly with people you trust. And I will say that oftentimes your primary care provider would fall into this category. I think it's also important to mention that notwithstanding all the concerns about the vaccines, medical people who were in many cases at high risk of exposure, as well as frankly having the knowledge base to understand the development process and the science of the vaccines, were among the first people to line up. Doctors and nurses were among the first to line up to get the vaccine, and so that should count for something. And as has been messaged all through the pandemic, it's probably wise to limit or be selective about news and media consumption. Then also, at the end of the day, it comes down to a personal choice of weighing the benefits against the risks. And for some people, and again, that's a very personal choice. I will just throw in that the increasing evidence of the long-term effects of COVID, heart disease, pulmonary disease, brain fog, and many of these other things, depression, that are being reported, really sort of make the argument that it's probably wise to get the vaccine. And here are some of the sources of information that I referenced earlier: the CDC, PDPH, Black Coalition Against COVID, and Boost Your Mood. Boost Your Mood is a compilation of resources put together by the Department of Behavioral Health and Intellectual Disability Services, aimed at supporting individuals who are experiencing mental health needs, either because as a result of COVID or independent of COVID. And thank you for your time.
Thank you, Dr. Schwenker, for that presentation. Now I'm going to introduce Nerissa Mixon, who is the Assistant Manager for Peer Culture and Community Inclusion and a Certified Peer Specialist, to talk about her vaccine experience.
Hi, I'm actually the supervisor of the Peer Culture and Community Inclusion Unit. And yes, my name is Nerissa Mixon, and I got the shot, the Moderna shot, early on. Because of the work that we do out in the community, we were considered first line responders. So I got the invitation in January and I thought about it. There was a little thought, but it wasn't much. It was about 5 minutes. And I decided to take the shot because of all the people that were dying, especially in my community, and especially those, I don't have any underlying conditions, but I also wanted to get the shot so that I could have lived experience so that I can report back to my community and others about my experience, my authentic and transparent experience of getting the shot. So I got the first shot January 19th. And when I got the first shot, I got it in my left arm. My arm was a little sore, but that was about it. And I was like, oh, okay. And so I got my next shot on February 9th, and it was in my right arm. And my right arm was a little sore. And I was expecting, really, truly, honestly, I was expecting to get some negative experience about it because I had heard other people talk how ill they felt and this and that. But honestly, I didn't feel any different. I really didn't feel any different. And I have been fully vaccinated since February, but I also continue to wear my mask and socially distance because I don't want to get the disease at all, even though now that if I get it, I won't be so sick that I would have to go to the hospital. But my goal is wellness. My goal is to stay well. So I continue to wash my hands and wear the mask and socially distance. And even during this time when the city is opening up, I still feel like I need to do that because there's some people that haven't been vaccinated, and it's the honor system really to say whether or not you want to. If someone asks you, have you did the shot? There's really no way to how would I put it, to substantiate that. So, it's an honor system. So with that being said, I still socially distance and wear my mask when I'm out in public. And when I exercise and I'm not around people, when I go walking, I don't wear my mask, but I have my mask with me in case I do run across people in my journey, and I put the mask on. I just want to say to folks that it's imperative that we get the shot because the more people that are vaccinated, we can begin to eradicate this virus. And it has been so devastating in many communities, and especially in my community, the Black community. Yes, we have some reticence about taking the shot because of historical trauma dealt around dealing in the medical field. But I did a cost benefit analysis and I said, okay, do I want to get the shot or do I want to take the risk of getting COVID and having all of the terrible things that happen to folks who get COVID, including hospitalization and death? So I would encourage everyone, please, please, please get the shot, especially if you have other family members that live with you that are elderly. You want to protect them. And you might not have it, but you could be a carrier. So I would encourage you and everybody in your family to get it.
Thanks so much, Nerissa, for sharing your story.
No problem. No problem. I hope it's helpful. And I hope that folks get the shot. I really am advocating to get the shot. No matter which one it is, whatever one is available, get it.